You're seeing vessels on your face, redness. People are commenting. It's starting to affect your life, your glow, and it's aging you. You want things you can do at home and in the clinic. And why is this happening? How do you get rid of them? But how do you prevent them? Let's get started. How are you going to get rid of the blood vessels on your face? Now, when most people think of aging, they say, my face is sagging. I'm getting wrinkles, fine lines. However, one of the most troubling issues people are struggling with is skin clarity, and they're getting increased redness, particularly spider veins, vessels, superficial veins, otherwise known in the medical world as telangiectasias, if you know that word. They're commonly small dilated vessels that are seen either on the side of the nose, very common for most people, the cheek, definitely more troubling, the chin, and they're usually less than 1 millimeter in size, but they add up. So they become confluent, and they may even get worse when you get sun exposure, when you get heat, anxiety, or when you're drinking alcohol, or even like 2 sips of red wine. So it's very troubling, I know. Remember, I often talk about light reflection, smooth skin, and clear skin that let others know that you're healthy and adds an element of youth that most people enjoy. When people get these increasing red superficial veins and blotchiness under the skin, they're very self-conscious about it, and people judge them for it. Whether they say, oh, you're an alcoholic, you're drinking, oh, you're bloated, what's wrong? Maybe you gotta go get a blood test. It definitely causes a tremendous psychological impact, and I understand. So with this in mind, let's give you my top solutions that I use in my medical practice and that I treat people with every day. Now, prevention is always better than cure. So what are causing these? Well, the same things that lead to overall aging, sunspots, and thinning of your skin and killing your fat pads lead to these vessels. Aging, so genetics, sun exposure, smoking, alcohol, hormones, and sometimes pregnancy. In that case, they might go away, but all those things kill your skin, your fat pads, thin the skin, and then you see the vessels. Now, there are drugs that cause them. Pertinent to this channel, when people are on permanent fillers or they just can't dissolve fillers because they went and got cheap fillers, sometimes we use steroid injections or even 5-fluorouracil, 5-FU. And when regular dissolving like hyaluronidase does not work, people get a steroid injection to stop the inflammation, and that can lead to hypopigmentation and these vessels. But overall, think of those factors as a cause. Let's go to number 1. Now, I'm going to talk about topicals in a moment, but by far the most effective, simple, if you will, you do have to go to a clinic and get it, but are lasers. And the number 1 top laser is called a pulsed dye laser, or some people know it as PDL. Now, this laser treatment uses kind of bursts of light. They're set at a specific frequency, and they're going to target what? Reds. So what? The vessel, the hemoglobin. So it's targeting the exact area that we want to treat and does not get rid of the surrounding tissue. Many of you know CO2 lasers or erbium YAG lasers that resurface the whole face. And these are not them. So you can actually look at a specific vessel, target it. It targets the color, zaps it. It actually targets and breaks down the precise vessel without targeting any surrounding skin. So you can go in and out. It's a pretty quick procedure, and you don't have a lot of the downtime associated with what I'm going to talk about in a moment, which is the full face treatments. You can also use this same laser to target dark spots, wrinkles, and even acne. These PDL treatments usually take only a few minutes to do, especially if you're just targeting a few vessels, and they're performed in an outpatient clinic visit pretty easily. Now, no anesthesia is required. You don't have to inject anything. You don't need nitrous gas. You don't have this big recovery. A lot of the machines produce this cold little hit of spray just before the laser pulse because it would smart, but that diminishes the pain. It kind of triggers the nerve first, and that diminishes the sensation, makes it quite comfortable. Most patients need between 1 and 3 treatments. So whenever we're talking any type of laser, if you're, I don't want to use an age, but say over the age of 30, 40, 50, or you have extensive damage, or a large lesion, you're going to need between 1 to 3 treatments, maybe more. If we're targeting like a port wine stain or a big area, even a hemangioma or extensive rosacea, then you might need more treatments. Improving the appearance of red scars or hypertrophic scars or keloids, stretch marks, that can take a variable number of treatments. And as with any treatment, you may get an incomplete response and you might get recurrence. So you may need ongoing maintenance every year, 2 or 3, depending on your aging rate and your exposure to what's causing it. Understand that's not a failure of your provider or of your treatment. It's simply the fact that we age every day. If you can reduce your aging rate, you need less treatments. What's that going to set you back? A single treatment with a great provider, about $500. And you might get a series. Sometimes you get a discount on that. But for the psychological impact of the reds and for the look you're going to get, and this is a long-term treatment, when they're gone in that specific area we treated, it's well worth the money for most people. Next, I'm talking IPL. Now, I love IPL. You might know them as PHOTOFACIALs. Usually with this treatment, we're going to target the whole face. It's technically not a laser per se, because what it is, it's a broad spectrum of light that comes out of the device. And then I put filters in depending on what I'm going to target. We can also target browns, of course, the reds like this, or a combination of both depending on how aggressive you want to be. You'll hear some people say that can target skin for tightening. But honestly, in real life, you need so many treatments to get tightening. It's not the treatment of choice for skin tightening. If you're doing, definitely some people love them. They do 5, 10, 15 a year. Yes, that could be your tightening device, but it just doesn't produce that amount of heat needed for kind of break. How you get tightening is you break down the collagen and the proteins, and then the body builds it back up. This device doesn't get to that level of heat. An IPL is going to be best for skin types 1 to 3 or the lighter colored skin. You can now treat the darker skin, but honestly, in my experience, a YAG, or which we'll talk about, or pulse dye lasers, probably overall better for darker skin types. One of the keys with IPL is when you go in, you want to have no prior sun exposure for weeks, because the lighter your skin, the more I can target the browns and reds, whatever I'm doing. And again, it's broad-based light, but we filter it through a range of nanometer wavelengths to target whatever we want. So it's pretty cool technology. Now, on my IPL, I also have a YAG. So on the same device platform, I got the IPL headpiece. I can just grab it if I want to use the YAG for a couple of lesions, and I often perform them both if needed. The YAG is a wavelength 1064. You may recall from my other video on Fraxels, I talked about the wavelength there, and the Fraxel, the original, is a 1550 nanometer. And when I talk erbium YAG lasers, like a Halo or a Pixel, those are around 2940, and the CO2 is up near 10,000 wavelengths, 10,400, 10,600 zone. So the YAG laser is particularly great for those people with darker skin because it's not easily absorbed by the melanin as other lasers do. So the laser bypasses kind of the superficial skin of the epidermis, and it really targets exactly what I'm looking for. It doesn't target the pigment, and that makes it safer for different skin types. A V-beam would be an example of one, and how much would you pay for that treatment? Very similar to your prior treatments. It's about $500 per session, and depending on the amount of lesions or how clear you want or how much you want, think of 1 to 3 sessions up to 4 to 5, depending. So a series is best. And keep in mind with a series, what we're doing, we're looking at the areas, we're treating the low-hanging fruit, and then I can up the settings every time you come in. That makes it safe. Imagine if you come in, I just hammer you at the highest settings. I could burn you, I could scar you, and lasers are the #1 cause of lawsuits in the aesthetic industry, because every great device, RF microneedling, lasers, anything that's going to get you a result can indeed harm you if the settings are wrong for you or for what we're trying to achieve. It's all about who's driving this. Now let's talk topicals, because I know you want to do things at home. And by the way, the lasers that I mentioned aforementioned, they're not things that you can really or should do at home to get to those levels. It takes a lot of experience and know-how, and you could harm yourself. And if you scar yourself, now you're behind the 8 ball big time. But if you're talking topicals, probably one of the best ones going to be a retinol. I prefer a retinaldehyde. It's not as effective at targeting these as any type of laser that you can get. It does what retinaldehydes do. They promote cell turnover, stimulate collagen, they minimize hyperpigmentation and fine lines, and they make the dermis thicker. Yes, I said thicker. It does not thin the skin if used properly. So by thickening the skin, it makes the vein less visible. Retinol will not directly treat or eliminate the spider veins, no matter what people tell you. It works to reduce their appearance. And one of the things with retinol, you don't want to have inflammation. So if you're using it so much, or you get irritation, or you get purging, it can at least temporarily make your reds worse. But if you're into using retinaldehyde, retinols, and you're willing to learn about it and judiciously build up, it can make them better, especially if you have mild, I'll call it disease. We call everything in medicine kind of disease, but if you have a mild level of this, then certainly this is worth a try at home. As it progresses, you'll probably go to lasers. Now you're going to want to watch this video on skin thinning, how to prevent it and reverse it. Also things you can do at home to keep your skin and body beautiful, healthy, and vibrant.